Hello, you probably heard this answer. I never learned about Lyme disease in medical school. Well, that was the case for me. This is part of a Common Sense Lyme disease series that I've started to address questions and answers. Now, it makes some sense why I never saw Lyme disease and never heard about Lyme disease in medical school. I went to the University of Minnesota. I started in 1977. Now, that was about the same time that Polly Murray, a housewife in Connecticut, noticed that her children had swollen knees, her neighbors had swollen knees, that there was a problem. She was able to finally go through several different opportunities. She met Dr. Alan Steer, who wrote up a paper called Lyme arthritis. And in this case, it was discovered in 1982 by Dr. Bergdorfer that the cause of Lyme arthritis was a spirochete. Now, in 1987, after I had finished my internal medicine residency, and after I'd been working in geriatrics and a director of an Alzheimer's unit, that I set up practice in Mount Kisco. I had three patients that I met who had been worked up by doctors, had been evaluated, had remained sick. Two of them had had Lyme disease already, and this was 1987. And so I would normally just send them to specialists. I did. I didn't have an answer. They still came back, and I was in primary care. Now, Lyme disease had been known as a great imitator in that it could be other diseases that that it presents as, but it turns out to be Lyme disease. So it makes some sense why I was taught about different diseases, but Lyme disease was not considered relevant at the time. So I had a patient that I wanted to discuss. That patient, he was getting worse. He had poor concentration, irritability. He had neck and chest pain, palpitations, and stomach pain, and his quality of life was plummeting. Now, he remained sick despite multiple specialists that he had been evaluated with. Now, this is a problem because the Lyme test is not that good. In 1994, they decided that the Lyme titer was not enough. Why don't they make it harder to accomplish? So they introduced a Western blot test, and you had to positive in both. It's just that this was used for surveillance, and a lot of patients, including this gentleman, did not have a positive test by the two-tier criteria. This patient would have been normally considered a chronic Lyme disease case, at least in the 80s. But there's some professionals who are not convinced that it is a persistent infection, and they started calling it post-treatment Lyme disease syndrome, which is a syndrome they assume is related to immune issues due to Lyme disease. Now, medicine is always evolving, so even though Lyme disease was not on my radar, it was not when it was on my radar. It was really not clear what the cause was. They discovered it was Borrelia burgdorferi. They also been discovering that there's multiple co-infections in the same tick, and so I'm stressing in this blog that I'm drafted was that medicine's evolving. Lyme disease got entered into the equation. It takes a while for medicine, longer than I would like, for medicine to take on the Lyme disease and incorporate it in their practice. Medicine must keep evolving. It's very important to remember that Lyme is one of those lexicons, those diseases that needs to get always introduced in medicine in cases, but also in research and clinical training. So the takeaway is that even though we weren't taught, it's still important as this disease emerges. This same problem occurred in other diseases, including H. pylori, which is the bacteria responsible for ulcer disease. So thank you for participating in this Common Sense Lyme series. This is a common question. Even I had to answer the question that was I trained on Lyme disease in medical school. I have to finally close in saying that even though there are CME courses you can take Lyme disease, some of them still focus on Lyme disease as a chronic problem that's a syndrome. And so there's a reluctance still to include that a persistent tick-borne infection could be the underlying cause of this chronic illness. So you can leave your thoughts in the comments section. You can read more detail in my Lyme disease blog. And thank you for joining me.